This is Lorrie's story. Lorrie is a 40-year-old man in Torquay who's recently entered substance misuse services for treatment for his drug use. He talks to Nicholas Smith from the public health team about his treatment. Nicola and Lorrie are not their real names, but they are real people. Their real names have been changed to protect their identities, and the conversation is read by actors.
So, Lorrie, tell me about how you first got in touch with substance misuse services and why.
Well, I first got in touch with services when I was 18 and had a drink problem and was very violent.
How old are you now?
I'm 40 now and I didn't get in touch with them again because I left the UK and moved abroad. But that's when my drug addiction got worse and I got into Class A's. I tried to kill myself because basically my relationship was built on a lie because I was trying to hide my addiction from my wife at the time.
Oh, that can be very stressful.
And then I came back to the UK and I was in and out of the UK and I didn't really get in touch with them too much. I was just getting in trouble with the police all the time. And every time I get in trouble with the police, I'd move back abroad and I think I'd be okay. And I'd come back and it just happened over and over again. But it wasn't until recently that I really broke down and I went to my parents because I've been homeless on and off for 6 years. Like I said, because I was going abroad and I thought I was okay. And I just broke down to my dad and gave him my money and said I just couldn't cope anymore because obviously I'd got onto heroin and I've been doing heroin for about 6 years, but it was just getting worse and I lost all my weight and looked terrible.
So tell me, this was around here?
Yeah, this was Torquay, so I was getting whatever I could, sleepers and that, and I was already on antidepressants, but I'd say they weren't working and then I realised that I really had a drug problem when I couldn't get any gear, so I tried pinning up my antidepressants just so I could have the needle fixation and put something in my veins.
Sorry, what does pinning up mean?
Injecting? Yeah, so I realised I needed help, so I went to my family because I didn't know anything about what to do. I didn't know anything about these sorts of places, so I went to the doctors and the doctors got me in touch with Shrublands. And then I had to go to Walnut Lodge, and that's where I met my key worker. And she was a godsend, a great person. Because the problem with me is I can stop drugs, but it's staying stopped because I have to live with my head after. My key worker had mentioned about this rehab program, and to be honest, I didn't really care about it at the time. I was just like, whatever, give me my script, I'm happy now, because I don't have to go out grafting or doing what I used to do to get drugs.
What's a script mean?
A prescription for methadone. It stops you withdrawing from heroin. Anyway, I had to do a recovery focus group for the rehab program, and there was this guy there who works for Shekinah, Grow for Life, and I remember him when he was in active addiction, and I was sat there and I was gouching. You know, I was so off it, but he started talking and he mentioned about Shekinah Grow, and he mentioned about this project. I sort of like propped up and thought that sounds all right. Next thing I know, I was in rehab.
And what's gouching?
You know, being out of it.
So you made a connection?
Yeah, and with my key worker at Shrublands too. I reckon it changed my life. From active addiction for 25 years, and I haven't touched anything now for a year. I can't say enough about them. I owe my life to drug services. You know, my kids are speaking to me, my wife's speaking to me. They taught me about myself and they got me into the rooms. Narcotics Anonymous. Yeah, it's amazing what they do in Jattis. They don't just kick you out if you use automatically.
It's not straightforward, is it?
It never is. And I didn't like it when people think that coming off drugs is that straightforward.
There are often reasons why people take drugs for long periods and then have difficulties in stopping them. Problematic drug use rarely happens in isolation from other problems.
Jattis made me look at my life from when I was a little kid, and they made me realise it was my choice to take the drugs. When I told my mum and dad about being sexually abused, I was only young at the time and they didn't believe me. They thought I was lying, and then they looked at me as a bad person because I'm the druggie. And this rehab showed me I wasn't a bad person, you know. I just made bad choices in life. Before, I couldn't walk through town without my hoodie up. You know, I was afraid to go into town, and now I don't care. I go into town, I'm happy with my life. I'm off my scripts now and I'm 64 days clean off everything.
Lorrie seems really happy with his progress and the prospect of a new life free of drugs.
I'm thinking of volunteering with drug services. I'm going to be starting some training courses next year because I used to use my dyslexia as a big reason for me not to do it. But with phones and spell check, you can't really use that as an excuse. So I'm looking at starting to do volunteer work down there. My key worker, she's asked me to do a talk to other key workers. I want to tell them about the most important thing in my view. It's easy stopping the drugs, but it's living with your head. Because you ask nearly every addict, the biggest problem is them living with their heads. I've always felt alone. I've always felt isolated. I've always done stupid things to fit in with other people, and that's what got me into drugs. I know they say a lot of people do fail at rehab, but the statistics are against us anyway, because at the end of the day, you need to work on yourself, and if you don't really want it, you're going to go back out there and score.
You look happy and healthy now.
Yeah, I'm healthy now. I like myself now. I've got a part-time job. I just want to get off benefits totally now, be a normal person in society and give back to society. And that's why I want to work in the drugs and alcohol industry, to just give back what's been given to me.
If you're thinking of seeking help for drug or alcohol use, Lorrie's story shows it's possible to come out of active addiction and work towards regaining a normal life. Please talk to your GP, who will be able to make you a referral into substance misuse services, or you can contact them direct.